The changing roles of community health workers. According to the American Public Health Association, a community health worker is a frontline public health worker who is a trusted member of or has an unusually close understanding of the community served. Globally, there are many names for health workers, including mother worker in Ethiopia and Anganwadi in India. The purpose of community health workers are to improve access to healthcare, particularly in rural or hard to reach areas, to increase the affordability in poorer communities where the alternative may be no access at all, to make improvements in primary care, specifically in the case of vaccine uptake and mother and infant health, and to bridge the gap between the community and formal healthcare system where there may be a lack of trust or understanding. There's a documented 50-year history regarding the presence of community health workers. This concept originated in China as Chinese barefoot doctors. A number of other countries followed suit, partly in response to the successes of this movement and partly in response to the inability of conventional allopathic health services to deliver basic healthcare. In Indonesia during the 1980s, there was a reformation of their healthcare system with a focus on district healthcare. Their goals focused on family planning, health education, growth monitoring, nutritional support, immunization, and treatment, particularly of diarrheal diseases. Results were significant, with infant mortality dropping by 30% and immunization coverage increasing manyfold. Of the 86 articles reviewed by the WHO on community health workers in developing countries, 19 of the studies focused on the cost effectiveness of community-based TB care compared to other strategies. The cost to the health service and patient was shown to be reduced by using community-based, directly observed therapy of antibiotics in many of these studies. One of the new challenges that caused the need for the shift in the role of these workers. Due to the huge increase in migration of people due to transport, job opportunities, and even war, community health workers are a key link to ensure that healthcare is available to everyone, regardless of any cultural barriers. The rising prevalence of chronic inflammatory diseases, mental health diseases, and antibiotic resistance are causing an increased need for specialization of community health workers. The ever-rising populations directly require an increase in health workers while also requiring more opportunities, for example, family planning at a local, accessible level. Let's talk now about how these changing needs have a direct effect on the roles of community health workers here in Ireland. In the HSE, many new campaigns have been launched to target and deal with contemporary Ireland's new problems. The Healthy Ireland Compass campaign was launched by Cork Kerry Community Healthcare this year, dedicated to improving the well-being of the communities and healthcare staff, focusing on decreasing the prevalence of chronic diseases via initiatives such as exercise interventions for staff and encouraging patients to take control of their own diseases. Safe Talk is a training day launched by the HSE. The Safe Talk leaflet states that Safe Talk is a half-day training program that prepares you to identify people with thoughts of suicide and connect them to suicide first aid resources. Most people with thoughts of suicide don't truly want to die, but are struggling with the pain in their lives. Through their words and actions, they invite help to stay alive. Those wishing to attend, contact their local health officer.